I first want to thank Dr. Singh for not only on a personal level being my doctor, but for all his commitment and dedication to the Ocular Melanoma Foundation. And I'd also like to thank Grant Allen and his father for establishing this Ocular Melanoma Foundation. The research, the education, and most importantly, I think for all of us, the patient support is just invaluable. So thank you, Grant. And a shout out to your mother too, Janice, who is lovely and continues to fight the fight for us. So thank you for that. This is the second time I've been to this conference. Last year was my first experience here, and I almost didn't come. You know, as Mamie said, I'm from this area, so it seems like a no-brainer, but for me, it's been a long time since my diagnosis, and I thought, what information could I really learn at this event that would have an impact on where I was on the journey? And at the same time, I thought, I love the Cleveland Clinic. I mean, it's been part of my life for a long time now. I love Dr. Singh, even though I shouldn't say that and embarrass him. And he's not laughing. And I thought, why not? You know, it's an opportunity for me to learn, just to learn, and more importantly, to meet other patients. And so my experience was just unbelievable. Not only is it amazing how advanced the medical industry is, but the information that was shared, I learned things that I had never known before. You know, unfortunately, some things I kind of wished I didn't know, but at the same time, the most important experience for me was meeting all of you and having the opportunity to just really connect with people that had this thing, this eye cancer. Because when I was diagnosed, I had no idea that you could even get cancer in your eye. And so now, my second year here, I've had the opportunity to meet some new people. And I think Grant said it best yesterday, and it becomes a family. And we're all connected by this rare disease that it just helps to know you're not alone. And so how appropriate the name of this conference is, you know, I'm not alone. And yet for me, I felt very much alone when I was diagnosed. It was 1999, actually this month. So October 1999, 16 years, yay. So that's my wish for all of you. We meet up again in another 16 years, and we're all healthy and vibrant. But I was really very much alone. Dr. Singh wasn't part of the Cleveland Clinic. In fact, the Cole Eye Institute wasn't even open. There was no Ocular Melanoma Foundation. I didn't know about Grant and his mother. There were no clinical trials, no new drug testing. I didn't know anyone who had this. And so for me, you know, I can remember the diagnosis like it was yesterday. And I'm sure for those of you who were just recently diagnosed, it's pretty raw. But for those of us who are 5 years out or 10 years out, we can remember it too. And so it was a Friday. I went to a local ophthalmologist, and the ophthalmologist looked in my eye, and then he left the room. And he came back in and he said, I want you to meet Dr. Peter Kaiser. He's a retina specialist at the Cleveland Clinic, and I want you to go there right now. He'll be waiting for you. And I thought, oh my God, I've got a retina problem. You know, this is serious. And so it's Friday night after 5 o'clock, not the happy hour I imagined, but you know, I drive to the Cleveland Clinic and I walk in. In fact, I had memories of it when I walked through the cryo building last night. And there was Dr. Singh's assistant waiting for me. And so they took me in, they did an ultrasound, and Dr. Kaiser said, you know, you have a malignant tumor. I'm like, huh? I mean, is that possible? And it's that time you kind of go a little numb, and it seems surreal. And at the same time, Dr. Kaiser was so caring. I mean, the clinic is basically dark and empty, and here's this doctor who I just met sitting down next to me and beginning to share now my treatment options. So the first option he mentioned was, of course, radiation. We all know that. And the second option was enucleation. I was so naive, I didn't even know what that meant. I'm like, what is that? It doesn't sound good. And he's like, well, that's where we remove your eye. I'm like, okay, now I really don't want that. Is there another option? And so basically, I was catatonic, and I had to sort of process. So I went home and I had to process this information. And I had my friends and family as support, but they didn't really know what I was going through because obviously, they're not in my shoes. And so ultimately, for me, it was about choice. And it was a choice that I had to make and a choice that might be right for me. And at that time, there was no way I wanted to think about having my eye out. Now, meanwhile, the research, as Dr. Singh said yesterday, not sure, radiation or nucleation, what's best for you. And many people may have just said, get it out, get the tumor out. But something about the eye that is sensitive, I wanted to hold on to it. So I opted for the radiation. And at the time, I had 6 days in the hospital. Now, I've never been in the hospital in my life except for birth. So kind of scary, intimidating. And when I got into my room, something about the skull and crossbones on the door, I went, whoa, this is serious. Now, the silver lining in that experience, I didn't have a roommate. But, then friends are coming going, should we be in here? I'm like, well, you can stand in the hall and talk to me, or come in at your own risk. So meanwhile, radiation does its job. It's shrunk the tumor. So over years, I spent years as, looking at the size. Every time I'd go to the doctor's appointment, I'd be writing down all the measurements. And so radiation, I call it the gift that keeps on giving. After time, I eventually lost my eyesight. Now, I knew this may happen in selecting the radiation. That was pretty clear. But again, another challenge along the path or on this journey that we're all on. And so for me, the biggest adjustment really was I got to change my driving techniques because I was a pretty aggressive driver. I had friends that didn't want to ride with me with vision in both eyes. So then I'd have to say, okay, I'm blind in an eye, and they're like, I'll drive. But you know what? I figured it out. And that's what we all, have to do. We just have to find ways to figure it out. And so 10 years after my treatment, I began to have severe pain in my eye. And that's actually when I met Dr. Singh. It was September 2010, and Dr. Peter Kaiser, who I also loved, I have an attachment to my doctors, if you didn't know, he had to pass me off in the hallway. I'm like, no, don't let me go. But then I got to meet Dr. Singh. And, Dr. Singh at that time said to me, maybe it's time to think about having your eye out. You got glaucoma, you got a cataract, you have pain, you've got a tumor, you can't see out of your eye, I can't see in your eye. I'm like, no, I'm not ready. Is there another option? And so we treated the pain, basically had to manage the pain with eye drops. And so for several years, Dr. Singh, I would see him and he'd be so patient with me. How you doing? I'm good. How's the pain? Or every time I would have to travel, I'd call him to almost get permission to travel or need more eye drops. And so ultimately what happened, the pain escalated. And Dr. Singh in his office one day, as if he had no other patients on his schedule, looked at me and said, what's holding you back? And I said, it creeps me out. It just creeps me out. And at the same time, I realized that it was going to be okay. And really it was time. And Dr. Singh's main concern for me at this stage was my quality of life. And, do you have a quality of life if you're constantly in pain? And so a year ago, Dr. Singh removed my eye. And that was a whole nother, sort of journey and adjustment. And I was sharing with some of my friends from last year my stories of how I adjusted to the 12 weeks after the treatment where, quite frankly, you don't have anything in your eye. And at the same time, I had the opportunity to meet this wonderful ocularist who lives 5 minutes from my house. And he made this eye that looked so real to me that when he put it in, I said, Daryl, I think I can see out of it. And he's like, you better still watch your driving. Do the double, triple take of looking at your blind side. So really, life is, bumps and journeys, and we just happen to be all connected here by this rare disease. And I think for those of you that, if this is your first time here, you're part of this family now. If you've just been recently diagnosed, you have support. You have people that have come before you, and we certainly understand what you're going through. And what I'm most grateful about and encouraged and hopeful is the progress that's been made and the medical information and people like Dr. Singh and your medical teams back at home and Ellie who has this new drug. I mean, what a time to live in. And so I think there's hope for wherever you are on this journey or this stage. We have choices. And when we sort of run out of what we feel like are choices, for me having my eye out, we still have a choice of how we respond to whatever is happening in our lives. My sister had sent me this quote from Charles Swindoll, and he said, life is 10% of what happens to you. So we got a lot of stuff that happens to us, but it's 90% of how we choose to respond to it. So I say, let's be grateful for where we are today on this journey, and tomorrow there could be another advancement that takes it to a whole new level. So hopefully 16 years we'll all be together, and I've been pushing for San Francisco, but Napa Valley. But so thank you. It's just a pleasure to be able to know that we're connected, and certainly I have not felt alone since I had the opportunity to be here at this conference and to meet all of you. So thank you. And now my new friend, Bill.
Good morning, everybody. I'd like to begin by thanking my family for coming today. And so my story starts in February 2005. I went to my optometrist to be checked out for golf glasses. And I told him I'm seeing white spots. And so he did the examination for the glasses, and he said, do you mind if my son Chad would take a look at your eyes to see what's going on? And I said, no, that's fine. Chad was studying at Ohio State to be an optometrist. And so Chad looked at my eyes, and then after he was finished, I saw him and his father, who was also a friend. My optometrist, we were personal friends and actually played golf together. They were, real serious conversations. And finally, Herb came over to me and said, it looks like you have a freckle in your eye. And it could be a tumor. And when I graduated from school, they used to take your eye out for that. But I think things are better. So he sent me to another doctor in Salem, Ohio, Dr. Petrozzoli, and he verified that I had the tumor. And then Dr. Petrozzoli sent me to another doctor in Canfield, Ohio, who also verified I had the tumor. And he said I had two choices. He said I could go to Philadelphia or I could come to the Cleveland Clinic. So I said, okay, the Cleveland Clinic sounds good. So as luck would have it, Dr. Petrozzoli called Dr. Singh, and that was on Tuesday. And on Friday, I had an appointment with Dr. Singh, which was absolutely phenomenal to get in that quickly. And so my wife and I came up to see Dr. Singh, and and he said to me when I first saw him, you have two choices. So I can take your eye out or I can use the plaque therapy. And so obviously I went with the therapy. And then he made a drawing of the tumor in my eye. And I was really impressed how well he did it. And then he said, okay, I want you to get downstairs, and they're going to take some photographs of your eye, and they're going to do an ultrasound. And so this was unbelievable to me. He walked my wife and I over to the elevator, and let us get downstairs. And what I found amazing is someone as important as him would do something so kind, you know. Anyway, so I get downstairs, and they do the ultrasound and all the photographs, and and come back upstairs. And Dr. Singh gets on the computer and looks at the results, and he said, "All right, okay." His drawing, and I'll explain why, this is phenomenal to me. It was within 1/10 of a millimeter of the dimensions he got from the ultrasound and the photographs, okay? Now, I used to be, before my retired life, I was a die maker at General Motors, and I used to make dies, you know, and work within thousands of inches, you know? And, so I knew what he was talking about. It just amazed me he'd be that close. So anyway, after that, we had the appointment about 2 weeks later to come in for the procedure, the surgery. And so again, my wife and I came up and went in, and it just moved like clockwork. And before you know it, surgery was over, and I was headed out to my room. Just like Vivian said, with a patch over my eye and cross on the door and all that. And so I stayed with the patch for 32 hours. And what I found interesting is, it's after talking with several people last night, that now it's longer, like 72 hours. So I guess the things have changed. I'm sure Dr. Singh can elaborate on that if he would like to. Anyway, so I got the plaque off my eye, and well, let me go back a little bit. One of my questions was, and this goes back to golf, when I first met Dr. Singh, I told him, I said, I'm planning on a golf trip in the spring, and if I can't go, I need to let the guys know so they can get someone else. He said, you'll be fine, don't worry about it. So, anyway, so after the procedure was over, then Dr. Singh said, well, you need to put some drops in your eyes and put salve in your eye. And as it would happen, I did that for a few weeks, and then like 2 or 3 days before I started playing golf on the golf trip, I quit putting the salve in my eye, and my vision cleared up. And it's been clear ever since. You know, it's just it's been just an amazing to me that Dr. Singh could cut the muscles in the bottom of my eye, put a plaque on, put it back in place, then take the plaque off and put it back in place, and my vision in my left eye is actually better than the vision in my right eye with glasses. It's just a phenomenal thing. So I would really like to thank the Cleveland Clinic for everything they've done, especially Dr. Singh and all of his associates. Everybody is just so kind and generous with their time, and I just can't say enough about this facility and the experiences that I've had here. Thank you. If anybody has any questions or comments, we'd be glad to take them now. Yes?
Once your eye hurt and you go away after, you did the initiation.
For me? Yes. And that's what Dr. Singh knew. And that's where, so the question was, did the pain go away after I had my eye removed? And yes, the reason that I had the pain was the glaucoma and just the aftermath of the radiation. And Dr. Singh knew that, and so patiently he waited for me. And once I had the eye out, no pain. So that's where the quality of life, I don't even have to think about it. It's every day after I had my eye removed, well, once I got over the surgery, I never had pain again.
Do you develop cataracts? The cataract in the eye?
No, I don't have any. I did lose some peripheral vision. If I remember correctly, the tumor was 3 millimeters from my macular, and the plaque that Dr. Singh used was something that was developed in Germany, and I think at the time, shortly after that, the FDA said that it wouldn't be approved in the United States. So I was fortunate to get that plaque, and the thing about that plaque was that it was shaped such that it reduced the dispersion of the radiation. And so that 3 millimeter distance, it never infringed on my macular. So I haven't, to answer your question, and I blabbered on about it, but I haven't had any problems with anything as far as, yeah, it's been very good.
Just want to thank you for sharing your stories. I had 2 questions for Vivian. First one is, what age were you diagnosed at, and have you been getting scans and blood work and everything
yeah.
since then?
I can't tell the age because that's like telling your weight, we found out as women. No, I was, well, do the math. I'm 57 now, so it was 1999. I think I was 40-something.
Okay.
41. My husband's trying to help me over here with, I'm not good with math. He's the math guy. And then it was considered, I was told I was young and that it was sort of a disease that was in more mature people. And I was thankful that at 40-something they were saying I was young. But, and as I look around now and I see young people, it's not age discriminate. So meanwhile, the next question that you had was,
do you still get scans and blood work to this day?
Absolutely. When I was first diagnosed, I was required to go through a lung scan as well. And then when I met Dr. Singh, he said, you know what, we've made advancements since the dark ages when you were diagnosed. And now it's just an abdominal scan. So I was getting blood work every year and the abdominal scan, and now Dr. Singh has just said, go for the abdominal scan, basically just to check the liver because we know that's where it may go. So yes, thank you. I'm very diligent about the follow-up.
MRI or CAT scan?
An abdominal scan. So when I still had my eye, I was having to go in every year for the ultrasound to make sure that the tumor continued to shrink and that there was no growth. Now that I don't have my eye, I get to bypass the ultrasound area. I miss Brandy at the Cleveland Clinic, but I don't have to get an ultrasound anymore. So it's just, the CAT scan of the abdominal. Yeah, thank you.
And I, in fact, I wanted to make sure that this happened. This past Wednesday, I had an appointment with the Taussig Center and about the cancer going to my liver, and I met Dr. Ernstoff, is who I saw, a wonderful, wonderful doctor, and he told me that unless something crazy happens, I don't need to come back to the Cleveland Clinic for this.
Vivian, I wanted to ask you, are you having CTs of your abdomen or MRIs?
I'm sorry?
For
CAT scans or MRI?
CAT scan or an MRI?
abdominal scan, is it a CAT scan? I don't know, I'm not a doctor. What am I having, Dr. Singh? What is it? It's an ultrasound. It was on ultrasound. Ultrasound, thank you.
And what did you have for cancer?
I had the ultrasound as well. Yeah, they did an ultrasound of my abdominal area to check my liver for any tumors. And then this last time, Dr. Ernstoff actually also did a chest x-ray, which I had never had done before. But still did the ultrasound.
Unfortunately, we have to wrap it up. Thank you so much.
One more.
We'll take one last question.
Yeah, hi, this is for both of you. I'm seeing in Philadelphia Dr. Shields and Dr. Sato. And I guess what I don't understand is why there isn't some consensus on universal testing. You know, some doctors are, their thought process is MRIs, either semi-annually or annually, and CAT scans of the lung.
So I think that's a question for Dr. Singh. You know, he mentioned that last night, alluded to it. So I think that's a nice question, and I think we should hold that for him because I'm not equipped to answer it. I don't know about Bill, but I'd rather Dr. Singh answer that one.
So in the science panel that follows in a minute, we're going to talk about that.
Thank you.